Dear students, let us learn about the Little's area. The Little's area is also known as Kesselbach's area. It's an area on the anterior part of nasal septum where number of blood vessels will form a plexus. So it is a highly vascularized region. So Little's area is a highly vascularized region on the anterior part of nasal septum, and that area is known as Kesselbach's area, and the vascular plexus is known as the Kesselbach's plexus. So this plexus is contributed by branches from the ophthalmic artery, which is a branch of internal carotid artery. That these branches that are contributed by ophthalmic artery are the anterior ethmoidal and posterior ethmoidal arteries. These arteries, they join with the branches from the external carotid artery, namely the maxillary artery, which contributes for greater palatine and sphenopalatine branches, and the facial artery, which gives the superior labial artery. The septal branch of superior labial artery will join the Kesselbach's plexus. So the Kesselbach's plexus is contributed by the three arteries, that is the ophthalmic artery branches from the internal carotid artery, the branches from the maxillary artery and facial artery of external carotid. Now let us see the arteries that are taking part in the Kesselbach's plexus. In the Little's area, they are the greater palatine artery, which is a branch of the maxillary artery, and anterior ethmoidal artery, which is a branch of ophthalmic artery. The posterior ethmoidal artery, which is also a branch of ophthalmic artery. The sphenopalatine artery, a branch of maxillary artery, and the superior labial artery, which is a branch of facial artery. So in this picture, a simplified diagram for representation of the arteries taking part in the Kesselbach's plexus. So the arteries coming from the external carotid artery and internal carotid artery are shown. The internal carotid artery gives ophthalmic artery, and from the ophthalmic artery the anterior and posterior ethmoidal arteries will take origin and they pass through the foramina and they supply the septum of nose and they reach the Little's area. Then the branches from the external carotid artery that are contributing are the maxillary artery and the facial artery. From the maxillary artery, there are two branches that are contributing for this plexus. They are the greater palatine artery, which is contributing for it, and the other one is the sphenopalatine artery. These two are the branches from the maxillary artery. And the third one, which you are seeing here, is the contribution from the facial artery, which gives the superior labial artery in relation with the upper lip. From that, a septal branch arises and contributes for the plexus in the Little's area. The mnemonic for remembering the arteries taking part in this anastomosis is GAPS, G-A-P-S-S. It is the greater palatine artery, anterior ethmoidal artery, posterior ethmoidal artery, sphenopalatine artery and superior labial artery. What's the clinical importance of Little's area? This is the common site of bleeding from nose and it is known as the epistaxis. The bleeding from the nose is called epistaxis, and the Kesselbach's area is the commonest site of bleeding from the nose. That is, Little's area is more common for the epistaxis in nearly in 90% of cases. The causes for bleeding is trauma due to nose picking, which is seen more commonly in children, and in the hypertension, or it can be due to iatrogenic causes like using of anticoagulants or foreign bodies that can cause the bleeding from this area. And you can see in this picture the treatment part of it is by compressing the anterior nares for 20 minutes. This bleeding can be stopped, and if it is not responding, then surgical cauterization of bleeding vessels has to be undertaken. Hope you have understood about the Little's area or Kieselbach's area and the vascular plexus in that region and the clinical importance of it.